coming to today's monthly seminar. And what we call our seminar series is TLC's Integrative Health Interactive Live Stream. I had it written out this time so I didn't flub over the name. Integrative Health Interactive Live Stream. So if you're watching from live internet world, you can they get into a chat or send you a question? All right, so you can type in a question, and Blake will be happy to let me know what your question is. Normally what we do is I have a series of questions, as we've done almost the whole past year. I didn't do questions this time because I thought the topic was so important and the new data that came out so important. You can interrupt me anytime, okay? We have a home audience here as well. So just raise your hand and let me know if you want me to clarify something as I tell you these things. So what I want to do is, can you hand something out to me? If you would hand everyone one of these right here. This is an outline of today's topic, okay? And in it, we're going to go over both sides and address some research that has been recently published. And you'll be very interested in this because we are going to be discussing probably the #1 killer in the United States, and I'm going to say it's lead. And I'm going to use science to back this up to help identify, thank you, that lead is probably the #1 killer in the United States. Oh, thank you for getting me water. And then we're going to go over probably the most recent level A grade science, the TACT trial. I'm going to cover that. And since I have this up as a little written screen here, I'll probably go there first. So on the order of this thing, it's at the bottom of the back side of the page. So if you flip to the back side and you come to conclusions, why don't we just hit the hard point, the conclusions. So the TACT trial, it stands for Trial to Assess Chelation Therapy. How many of you all know what EDTA Chelation Therapy is? So about 2/3 of you do. EDTA, ethylene diamine tetracetic acid, is a amino acid, a man-made amino acid that was created in the 1930s. It was created in Germany. They had the patent there. Later it was bought out by Abbott, the pharmaceutical company. And it was designed to take calcium out of dyes in the clothing industry. World War I had happened and they had some chemical warfare, and arsenic was used in the chemical warfare. And EDTA also, along with other variants, could pull out arsenic. Okay, so it had an actual industrial purpose. We have EDTA in your cornflakes. It's in your foods, your cereals. It's all in your cereals. It's in your little blood tube when you draw your blood to preserve it so your little blood doesn't oxidize and age in the little tubes. So it's got EDTA in it when you do a blood count. It's in your makeup, ladies, men, in your personal health care products to preserve so it won't oxidize your makeup and so forth. But unfortunately, also in your makeup is heavy metals, okay? The color, is a heavy metal. Anyway, so that's where EDTA was. And World War II time broke out, and some military doctors, we had lead-based paint, and they were painting the ships with the lead-based paints. And the men that were too old to be conscripted, I think you could be up to age 45 in World War II, and they'd still take you on active duty. Today, they take you up to 43. But they were painting, and many of these men had issues with high blood pressure, hypertension, angina, ischemic heart disease. And they would, the military doctors would prophylactically chelate these men because they were around the spray and the lead-based paint. And when these men got chelated, they found out that their blood pressures improved, their chest pains reduced or went away, their EKGs normalized, and they did much better. Then some physicians in Michigan started giving this also to their patients for the same reason, for cardiovascular disease. And they assembled some clinical papers, findings, to address, and were attracting interest in this. Two cardiologists had started getting involved in it. An NIH scientist, Dr. Sevens, got involved in starting to do a big study on EDTA chelation as a cardiovascular drug. Unfortunately, Dr. Sevens was killed in a motor vehicle accident in the mid-50s, late 50s, and as it was getting closer, right around the turn of 1960, the first open heart surgery was starting in Cape Town, South Africa. Dr. Christian Barnard did the first open heart surgery. And so the emphasis to really make the growing specialty of cardiology, I guess, more sexy with open heart surgery, something as mundane and cheap as EDTA chelation therapy was poo-pooed. And so pressure was put on the cardiologists that were working with Dr. Sevens from the NIH, and they retracted their data and said, well, maybe it isn't as good as it is. And then the patent expired from Abbott in 1969. And so this made a death blow to chelation therapy. And then all this excitement over open heart surgery, catheterizations, revascularization of your coronary arteries, bypass grafts became just the thing to talk about. So EDTA is an amino acid then that can pull out calcium and many heavy metals like lead, aluminum, mercury, arsenic, tin, plutonium, thallium, uranium, all these things, okay? It is an excellent lead chelator, and it was FDA approved to remove lead. So a lot of little children who would eat lead-based paint, that their cribs were painted with, because they didn't stop and get rid of lead-based paint until the 1970s, and I think they pulled it out of all the cars in 1980 or somewhere around that time frame. But these little kids would, teethe on the crib, and they would get little chips of lead in them, and they would become colicky in their stomach because it was burning, kind of hurting their cell membranes. And then they would become encephalopathic because lead is well established to be neurotoxic, and nephrotoxic, would kill their kidneys off, and these little children would die. So when I was in training at Cook County Hospital in the 1970s, I had the experience of seeing some children come in, and we saved their lives by just giving them this little innocuous amino acid right in their vein. We saved all these little kids. So that's kind of the background story of EDTA chelation therapy. I have some personal experience with it, but that's on the side. I've been around chelation therapy since I was 7 years old, and I understood what it was. My father was a food research, science member at Armour Food Research, and my grandfather had unstable angina, so that even sitting, he could start getting chest pain, crushing chest pain. And back in the 1950s, when I was a little girl, he would reach for his nitroglycerin, and I would watch my grandfather nearly die until he could get that nitroglycerin in his mouth when I was 7. So my dad had my grandfather chelated. This was at Great Lakes Association for the Advancement of Medicine, and they started in Zion, Illinois. And my dad got something like 30 chelations for my grandfather, and he went from, and there was no open heart surgery for him because back in the 1950s, the first open heart surgeries hadn't occurred, right? So in the 1950s, my grandfather went from sitting, crushing chest pain, waiting to die, to a man who went back to his barbershop work and lived his life and lived until I got to go to medical school after chelation therapy. So I became intrigued with it, and Dr. Ray Evers in Andalusia, Alabama, was my doctor. I had a heart issue when I was 16, and I got chelated when I was 16. Okay, so I learned all about this. I got into the alternative world since I was 7 years old. So I'll be 66, and so you could say more than half a century I've been around this stuff. I know it in and out. And I taught chelation therapy. I was on the board of ACAM, the American College for the Advancement of Medicine. And I was there when the TACT trial was coming to its completion, and I met the principal investigator, and I was there at the birthing of all the knowledge of the TACT trial. So let's talk about why it is shaking the foundations of American healthcare, why we stubborn doctors hold on to it like a bulldog with their bone in their mouth. Why have we held on to EDTA Chelation Therapy all these decades, roughly 60? It's because it works. And the TACT trial came up because, after Dr. Sevens died and the two cardiologists and the patent expired, we doctors wanted to try and get funding for a bigger study on it, okay? And we just couldn't do it. So there'd be smaller studies done by several doctors, and there were, many, many studies. And Dr. Terry Chappell, after a while, took all the studies that really had credible, scientific methods, and out of the 42 that there were, I think there were about 19 or 18 of them that met the criteria for the scientific method. I think that most cardiologists would have accepted. And they reviewed the 18 or 19 studies and did a retrospective meta-analysis of all the data. And they found that there was an 88% relief in blood flow, perfusion, vascular nature in all these studies, 88%. So with that in hand, and with us doctors doing this, and we're talking about millions of chelations every year, okay, for decades now, we took this to the NIH and ACAM, the board that I was on in teaching this, was very instrumental in helping this get all brought before the NIH. And they finally allowed us to do a study on this. And it started in 2002, roughly, 2003. Dr. Tony, his name is Tony Gervasio Lamas, was the Columbia head of cardiology. He was selected to be the principal investigator, and he ran the TACT trial to assess chelation therapy. And most of the physicians thought, all right, this will be the nail in the coffin. We'll put chelation to the side. But instead, what happened was something really remarkable. We had a grade A, $32 million finance study. It involved 1,708 participants. They all had to have had a heart attack to be qualified to get in. They all were managed with standard of care. They were on aspirin or Plavix, or they were on ACE inhibitors, and they were on beta blockers. So they had the standard of care any cardiologist would have given someone who had a heart attack. And then they were randomized to the group that would not get the chelation or the group that would get the chelation. And they also made the argument that most chelation physicians, and I myself do it as well, we work very much with antioxidants, multivitamins, okay? And there is an argument that since it might chelate out calcium, most chelation physicians have always given a multi-mineral multivitamin when you do chelation therapy. So they got the trial to address a group that got the chelation with the high-dose vitamin, then another group got the chelation without the vitamin, okay? Then another group did not get the chelation. It was just water saline going in them, but they got the vitamin, okay? And the last group did not get the chelation. It was just water, and they did not get the vitamin. So there were 4 groups. So since it's up here, let me show it to you. If you look here at this, these are the events. And what would be the events? If you had a heart attack, you're at a really high risk of dying from falling over dead soon, right? You have one heart attack, it's very likely you might have another and die, right? So death would be an endpoint, an event. Number 2 would be having another heart attack. If you had one heart attack, you very likely will have a second heart attack. Agreed? Thirdly, if you had a stent put in, coronary artery, it can get very often reclogged, right? Can it? That'd be another event, getting clogged up again. Number 4 would be being hospitalized again because you had unstable angina. That's an event. You're just frightened. You're at home. You're having more chest pain. And 5th would be a stroke. So these 5 parameters were studied. and this would be the event arm right here. This is time in months, and I want you to realize this is 5 years, 5 years out, 5 years. But when we start chelation, we're doing 40 chelations, okay, with the standard EDTA chelation, okay, 40 chelations, and they were all done in a year, okay? But what's remarkable, if you look at this, is over time, you see in green, this is green here, the people who got the real chelation and the vitamin, they're the ones who stopped moving in the progression of cardiovascular disease. And this is me writing here. I don't have a PowerPoint that I can capture on the video right yet. The blue line represents getting chelation, but no vitamin, okay? Blue did second best, okay? The brown, they did not get any chelation, but they did get the vitamin. And so here, you can see it did third best, okay? So what do you want to make a statement about vitamins? Don't ever come to me and tell me vitamins are just expensively peed out urine vitamins, right? How many have heard if you take a multivitamin, all you're doing is peeing expensive urine? Well, here is absolute proof. In a grade A level, double-blinded, the doctor didn't know who would get the chelation. The patient didn't know who was getting chelation. They just got similar looking bags of IV, and they got placebo capsules or real multivitamin capsules in these groups. Do you see what I'm saying? So nobody knew who was doing what. And here we can see absolutely multivitamin, antioxidant minerals make a difference in your overall health. So that's a side feature that we pulled out of this research. And then last is the no IV chelation and no vitamin. And all these people are on standard of cardiology care. They're all on their Plavix or their aspirin and their beta blocker and their ACE inhibitors, okay? Here is your standard of care, folks. All right? Now, so what did we see? Let me go to, since we jumped ahead. So in the EDTA and vitamin, okay, which is the best one here in the green, we saw an overall 26% all-cause mortality, all-event reduction. 26%. Now, are any of you in healthcare here? Yeah, a few of you. Don't you think a cardiovascular drug, obviously these cardiovascular drugs, the standard of care, can't compete even with vitamins. Do you see what I'm saying, folks? All right. And then what we notice is in this group of people, about a third of them, a little over a third of the 1,708 people in the study were diabetics, or they had higher blood sugars, or they were on diabetic medicines trying to control their sugar. All right. Diabetics now. Now, how many of us know that all diabetics have worse prognosis for arterial, heart attack, peripheral vascular, blindness, you know, their blood flow to their eyeballs gets messed up, right? Right? Yes. We all know this. So diabetics have more damage quicker and worse, right? So they looked at all the participants and they said, what group of these people were diabetic? And a little over a third of them were. And so what they did is they look now just at diabetics, okay? So these are going to be the diabetics. And whereas you saw all the lines look almost on top of each other, right? Didn't you see the lines were almost all together? They started to see immediately the diabetics started, even in the first 12 months, pulling out with lower event rates immediately, all the diabetics, okay? And what we found was if we separated out the diabetics, okay, from those who were on, remember green is the guy who got the chelation and the high-dose vitamin. Red is the standard of care, no chelation, no vitamins, okay? So when we took out the diabetics, look at what happened to them on the yellow. Look at what happened to them on the yellow down here. Look at that. Now, do we have a tsunami of diabetes exploding in the United States of America? Yes. All right. Almost, getting near half the population in this study was diabetic. There were 1,708 participants. So I think we're going to have more and more cardiovascular disease, okay? Much more. Now, let me tell you the difference between these populations, standard of care and getting your chelation and high-dose vitamin. 41% reduction in all-cause mortality. Hey, if you go to a doctor, wouldn't you like to go to a doctor that offers you a 41% reduction in all-cause mortality after you had your heart attack? 41%. Ladies and gentlemen, this should have been in the news, don't you think? Yes. Then you need to ask yourself what's wrong with your news. Okay, then the next thing is the percentage, if we took out the diabetics who had peripheral artery disease, okay, because they all tend to have the eyeball disease and get the ulcers of their toe and gangrene and cut off, right? That was a 58% reduction. Now, I put it in yellow, light, and I'll tell you why. Because the number of patients who were in the study who also had peripheral artery disease was not statistically big enough of a group of people that we can't publish it, okay, as official yet. So what happened? If you see the difference here and in these other ones, what happened? We see in 1 year, we see diabetics pulling out and getting some benefit early on. We see a reduction. So the green is lower for a reason. We see improvement. But notice, everyone was done with their 40 chelations here. What's happening? Why are we seeing such reduction over 5 years? Well, that's why I am telling you that lead, because EDTA chelation pulls out the heavy metal toxin lead toxicity, which is known established in research to be damaging to vascular walls, okay, your blood vessel walls, nephrotoxic, neurotoxic. Remember the little kids who get, encephalopathic and GI colic from getting a little piece of it, right? All right. So we are reducing the total body burden of a toxin, and we are seeing healthier people over the period of 5 years, still getting benefit from their 40 chelations. Now, isn't that amazing? That's amazing, okay? You give me a drug that you can stop for 4 years and still see improvement. Show me that. Show me that drug, right? It doesn't exist. All right, now let's talk about what they did then is they saw such an improvement here. And this was presented at the College of Cardiology in Los Angeles in 2014. And you know what those cardiologists did? They yawned. Oh, don't bother me. Don't get up at 3 o'clock like I did this morning to make sure I had some things here, Just let me make my money and do my job, Not all cardiologists, but anyway. So the long and the short of it is, what we find is EDTA reduced the cardiovascular event rate in and of itself, just chelation IVs alone, even without the IV, 18%. Your drugs don't do that. Oral vitamins reduce the events 11%. That's just with a vitamin. EDTA with the vitamin reduce events 26%. There's no cardiovascular drug that can do that. Now, in medicine, there is in science a term we call the number needed to treat before you see the powerful blessing of the drug that you give them, all right? So let's say you all have the same disease, and I take a drug that was studied, and I give all of you this drug. Are every one of you in this room, because I diagnosed you correctly with this disease that you all have, and I give you the drug, will all of you get healed? Not likely. We're too complex, right? We're too complex. So there is a number needed to treat. Even though I've got the right diagnosis and you all have the same disease and I give you the drug that was designed for treating it, not all of you in this group of 15, 20 people in our home audience are going to get better. So the number needed to treat, if you were taking aspirin, how many of you have heard to take aspirin to have good cardiovascular health? Prevention. Have a baby aspirin. You want to know that what the number to treat there is? 35 to 62. 35 to 62 people have to be on aspirin before it saves a person from an event cardiovascularly. 36 to 62, all right? The number needed to treat, if you took the vitamin with your chelation, the number needed to treat is 6.5. Which do you want to do? Rely on a baby aspirin or an antiplatelet factor? Because they were on Plavix and things like that. So you need to know about chelation therapy, people, if you want to live long, well, and have endurance in your late 60s like I do. All right. The other thing is the number needed to treat if you just did the chelation alone, okay? Even better, remember aspirin is 36 to 62. Just chelation alone is 12. Why don't the cardiologists know this? It's published. This is grade A level science, grade A level, double-blinded, placebo-controlled, randomized studies funded by the NIH, okay? All right, so the TACT conclusions are that diabetics receive the greatest benefit, but in our country of high carb indulgent eating and many people getting into those higher blood sugars and near and pre-diabetic ranges, this is going to become an even bigger killer. It's our number one killer. So if you take chelation with the vitamins, you are going to see, if you're not a diabetic, a 26% reduction in your relative risk of an event after having one heart attack, being over 50, okay, and not being a smoker. EDTA with the vitamins in diabetics reduced your relative risk to 51%. Now, how many think that's pretty darn good? So this was so impressive, even though the conference on the College of Cardiology yawned, we were jumping up and down excited, and Dr. Tony Gervasio-Lamas, who was the head of the Columbia Medical School cardiology principal investigator for this test, so he's a cardiologist, who himself I met when we were presenting this in 2014 when I was on the board. He said he fully thought that we were going to be able to prove and put to rest finally that all these millions of chelations that are done every year is wasteful and a waste of your money. And he said he totally flipped. He now is a chelation advocate cardiologist. He now is. And he got really angry with his colleagues. And they said, we want more tests. Now, remember, Dr. Chappell had done a study of all the ones that were published that met the criteria of good scientific methodology. And out of the 42, he found about 18 that were excellent. And out of those 18, he did a meta-analysis, and there was an 88% benefit, okay? It wasn't the exact kind of a test, but it was very valuable. So it's not like there weren't other tests. Don't you think this is something that you would want to give your loved one? If it's the number one killer, and it's a safety issue, hundreds of thousands of millions of these have been given around the world, and there's no deaths compared to your death rates from open heart surgery, catheterizations, side effects from the drugs that they're on, falling, getting a bleed, having a bad side effect to an ACE inhibitor, things like this. But no, so they wanted another study. So what did Dr. Lamass do? He went back to the NIH, and now there is TACT Trial 2. TACT Trial 2 is now 3 years into it. And what they did is they saw such a benefit to diabetics, they actually want diabetics in their study, okay? And their goal is to get 1,200. They have about 700 now. He's in Miami. And again, they said, and I suspect they're at that point, they're seeing such a dramatic benefit, even though it's blinded. At a certain point, you can tell which people, if there are toe ulcers that wouldn't heal before getting better, you know that guy, diabetic, is on it with peripheral vascular disease, because that's exactly what happens. And so the study is ongoing. It will be done probably in 2 more years. And it is suspected then that it will become, in 5 to 7 years, a treatment offered by your cardiologist, chelation therapy, and will be covered by insurance. And I suspect a lot of this is being delayed to get all the cardiologists finally up to snuff to do this. But in the meantime, if it's the #1 killer, then we need to be doing something about it for ourselves and periodically getting chelation, because we at least know there's a 5-year long-term benefit, okay? At least a 5-year long-term benefit. So
I have a question from here. I think you'd love to jump on. They say, should healthy people who are not diabetic with no heart disease still consider chelation?
And the answer is yes. The reason why that is thank you, it's the next thing that I'm going to be talking about, and that's the fact that lead is everywhere. It's in the dust. You, in fact, are breathing it in you right now. It is in the dust of the air in here, okay? Lead was produced in industry since roughly, the turn of the century, the 19th century, 20th century rather, around 1926, cars and all that were becoming very popular. And lead was an additive to gasoline to stop the knocking, okay, the knocking, to create a more even combustion. And all heavy metals allow for oxidation to be better because it's an oxidizing agent. You breathe it into you and it's burning you, oxidizing you. It's oxidizing the lining of your blood vessels. It is well established to damage the nitric oxide synthetase enzyme system in all your blood vessels that help dilate you. Men, you're always wanting to have your best erections and sexual performance. And so we go for Viagra, which was designed to be a blood pressure medicine, because Viagra is involved in helping production of nitric oxide, okay, which allows for vasodilation, which they found gave men very good erections. And so they switched the marketing to being a sexual enhancement drug, even though it's a blood pressure drug. So what did they find? EDTA chelation, EDTA itself reduces the lead that is known to damage the ability of the lining of your blood vessels, the inside lining of your tubes of your blood vessels will produce nitric oxide to respond to vasodilation and blood flow needs. And if you build up lead, you're going to shut that off. You're going to start getting ulcers on your toe like a diabetic. You're going to stop thinking. You're not going to have memory. You're going to get tingling paresthesias. You're going to have all these cardiovascular high blood pressure problems. So lead is known to be a nitric oxide diminisher. If you take EDTA chelation, it's known to improve nitric oxide performance completely. So there are many, many metals, and when they decided to do the TACT trial test, they wanted to see, they're looking for mechanisms of the toxicity of lead, and lead's everywhere. Do you know how much lead is produced in the earth, in the world? They estimate around 260,000 tons of lead were pumped into the air in industry globally, peaking around 1980. That's a lot of lead dust, folks. That's a lot of lead dust, and it's everywhere now. It's everywhere, okay? So every time you breathe, you're breathing in lead. Every time that dust lands on your organic food, It's still sucking up the mineral lead into your organic vegetables. It's getting into the water system, so you should filter your water and things like that. So if the person on the internet says, should you, who have not had your heart attack, who is healthy, and you're not 50 yet even, should you do chelation therapy? And the answer is yeah, because what they did for mechanism on this new study with peripheral vascular disease and the diabetics, they did a large group of them, sampling them, and they got their IV chelation, okay? But before they gave their IV chelation, they urinated, in a bucket, and they measured how much lead and aluminum and tin and arsenic and cadmium and thallium and all these things were in the bucket just when you pee, right? And then they compared it the next day to getting the IV with the chelation, and they collected 6 hours of urine after that IV chelation. And guess what those diabetics peed out compared to the urine without chelation to the next day with chelation? About 7,000% higher volume of lead the next day. 7,000. It was 689% something, 680 percent, not almost 7,000. Okay. Now, the cadmium was about 700%, whereas the lead was about close to 7,000%. So just think, there you go, you urinate here today, and you're going to get a little bit of lead out because you do detox a teeny bit when you pee, in your sweat and in your bowel movements. But if I give a chelation to you and I look at the lead coming out of you, you're going to get 7,000% coming out of you. So let's talk about this. If 700% goes up with cadmium, excuse me, I said 7,000. It was 700% with cadmium. It's 3,887% with lead. 3,887%. Excuse me. All right, that's still too much. 3,887%. So let's go to let's talk a little bit about the vascular toxicity of metals. I would like to pass out some of these things. Could I pass this out here? And we'll talk about this article in a second, but I want you to understand what lead does. So you're exposed, you're breathing it in. About 50% of the lead you breathe in is assimilated into you, 50% is exhaled. You get a net retention of this. Your excretion does not keep up with your exposure. And then you have what we call bioaccumulation, okay? And the patterns of toxic effects of heavy metals like lead, aluminum, cadmium, arsenic are neurodevelopmentally, lead is damaging, cadmium's damaging, aluminum's damaging, arsenic is damaging. And let's look at common sense. How many of you remember Flint, Michigan, where the water had too much lead in it? How many of you remember the stories? This was last year. And there were deaths. And they didn't give these poor kids chelation, to my knowledge. So we know that children also in the Flint, Michigan area were proven to have lower IQs out of the general population. We know that juvenile delinquents have a higher blood level in their blood serums on studies. So if you go to a place where they house kids who are truant and juvenile, and you do blood lead levels on them, they're all higher than the average population. Why would that be? Because often these children come from inner cities where there's a lot of industry and there's a lot of cars and a lot of airplanes and a lot of exhaust, right? And their lead levels are higher, right? And it damages their IQ, proven, hands down. So need I say anything more about neurotoxicity, neurodevelopmental? Do we all understand and agree how damaging that is? Yes. All right. And then what is not as well known are there many, many studies on mitochondrial toxicity, your mitochondria. How many people have chronic fatigue, fibromyalgia? Well, much of this is being discussed as a damage to the enzyme actions and the membranes of the cell and the inner mitochondria of your cells. Much of the research on oxidative stress to the cells and the lack of energy performance is from heavy metal toxicity. And then there is genotoxicity. Genotoxicity is there's known DNA damage. A lot of studies on that. That would be a lecture in itself. Just the nephrotoxicity, the kidney toxicity, the mitochondrial energy generation toxicity, the neurological toxicity, and then there is endocrine toxicity and infertility. All right. So we're not talking about something that is uncommon. Okay. Now, what does it do? The research in general shows, how many are you familiar with your liver is your major detox organ? Your liver is your major detox organ. And so there are patterns of enzymes that take bad things in your diet, toxins that get into your body. And on an aside, you know, the cord blood of newborn babies, when they test the blood of newborn babies, on the average, there's about 56 toxic metals and chemicals in the blood of newborn babies today. So do you think mother is detoxing into her baby? You better believe she is. And the cord blood level of lead in a mother is about 1 level, and in her newborn baby, it's 50% higher. She detox into the baby. So there's a lot of research on this about the toxicity. So in your liver, these enzyme phases, we have phase 1 enzymes, phase 2 enzymes, and that's taking toxins out and packaging them so that they can become water soluble usually and be urinated out. Okay. Yes, there's a question here.
Can you do chelation if you're pregnant?
I have done chelation on pregnant women. The absolute answer is yes. Now, is this commonly taught? If I was at ACAM again teaching chelation, I would not teach them officially that we chelate pregnant women. All right. But when I see a mother who's come from an inner city and her blood level's high and she just found out she's pregnant, I would say get rid of those toxins. The more you get rid of, the better. And so, yes, I've done chelation to pregnant women. And the baby came out fine. I haven't done a lot, but they've done absolutely wonderfully. And she's a super duper 13-year-old now. That baby was born at about 28 weeks. So she was an older mother who was trying very hard to get pregnant. And the baby came late in the 6th month. I think the baby was 2.5, 3 pounds at birth, a little girl. And the NICU unit doctor said to the mother, said, boy, your little girl's probably going to have neurological problems, that child was out of NICU in a flash with all the other things we were doing, okay? Because we don't just do chelation here. We help repair the membrane. We help the mitochondria. We help stop the blood sugar damage that is known to damage your vascular system. Do you understand? So when we do all these things and we help give them the stuff that the tissue you're made of is fat and protein. So we encourage a very healthy phospholipid-based diet and nutrients and iodine and vitamin D and things like this. And so the baby did so well, they couldn't believe how neurologically advanced the baby was with all the nutrition. And she got out of the NICU unit. I think she went up to 4 pounds. She almost doubled her weight. That was their rule then. You had to double your weight to let her go home within a month. Now, normally they're there 2 months, 3 months, okay? But anyway, that's a side issue. So we talked about the patterns of toxic effect affecting your neurological, immunological. How many times are our immune systems failing us? We're getting these viruses. We're not fighting our cancers. We're not fighting our infections as well. And the white blood cell counts are just going down, down, down. When I was a young doctor in the 70s, everyone had a white blood cell count of around 6,800, 7,500. Today here in California, in the last 15, 20 years, everyone's like a 3.6, a 3.2, Well, I think that you guys are all toxic, okay? And you're not getting rid of your toxins, okay? All right, and endocrinological. All right, so we know that heavy metal toxins kind of clog the detoxing drain at phase 1, okay? But they also clog the drain at phase 2. And phase 2 is usually those things like your glutathione managing system. So glutathione is a very important antioxidant that is used in helping to solubilize and detoxify toxins in your body, and heavy metals destroy the glutathione pathway in your detoxing. Plus, it damages your methylation pathways. How many of you have heard of methyl-tetrahydrofolate, and your B12, and having your gene SNPs that are damaged, heterozygous, homozygous for that. So if heavy metals are damaging your drain, you're building up toxins. You're damaging your mitochondria. You're going to get tired. You're not going to be able to get through that flu virus, and work without getting sick, All right, so we covered some of the neurotoxicity of it. Let's talk about a little more of our internet question. I think I covered methylation. I talked about glutathione. I talked about the clogging of that. Okay, let's talk about nitric oxide. I talked about that, didn't I? We went over the fact that heavy metals really damage the vascular dynamic regulator. Nitric oxide is involved in almost all blood vessel pathology, whether it's platelet aggregation, smooth muscle proliferation, attracting of leukocytes to invade the lining, and building up your little plaque. And how many of you have children who have acne? How many of you had kids who had acne? Okay. And when you see a kid with acne, what do you tell them? Mom, I want better skin. What should I do? What's the first thing you tell a kid who's breaking out with acne? Wash your face. All right. So you start, telling them to clean themselves up and change your diet, right? Don't you say eat better, right? So you don't, you're saying you're breaking out in your skin because of your lousy diet. Isn't that common? Yeah, if your kids would eat better, okay. I want you to think that, think of this, cardiovascular disease is acne of the lining of your blood vessels. Ooh. It is, because you're eating usually the typical sad American diet, high in refined carbohydrates, sugars, moving toward your diabetic state, inflaming yourself, scratching the lining and damaging the lining. You're bioaccumulating toxins, and your poor little endothelium is trying to repair, but a pimple shows up called a plaque, and then it pops. And when that pus comes out, it makes a sudden clot, moves towards a clot. Isn't that a nice way to think of cardiovascular disease as adult acne of the lining of your blood vessels? All right, but so you can see you're getting the picture of these things, and these are all well studied. Okay, so you could do a whole lecture on endothelial nitric oxide, and nitric oxide synthetase damage from heavy metals. And notice most of these studies are just looking at one metal, just lead, and yet there's cadmium, aluminum, arsenic, mercury, right? Thorium, uranium. So in this situation, we're looking at one metal, and we're going to get to this next study I want to talk to you about. And that is the one I handed you. Okay, that study there, where is it? So we covered the chelation ones on the TACT trial. This thing I handed you is talking about low blood levels, okay? And this was published in March of 2006, and it shook the healthcare industry in the nutritional world, okay? And basically what this thing is saying is that your risk for cardiovascular disease is far worse than you had ever realized because of your bioaccumulation of heavy metals. And what they found was the blood lead levels that were in the range of under 10, and they focused on between 1 and 5. And they looked at this, and they found that there was a 25% increase in all-cause mortality depending on the level of your blood level in the quote unquote safe ranges. There was a 55% increase for those who were in the ischemic heart disease range, and there was a 51% for myocardial infarction and stroke. In the low levels, ladies and gentlemen, in the low levels, in levels that are considered by the CDC to be, oh, that's not a problem. There is no safe level of lead. And if you read your article, you'll read and hear their comments. There's obviously no safe level of lead. Now, let me ask you, if you look at this and you there is some light in the cloud, silver lining. We are starting to see a little reduction in cardiovascular deaths, but it's still our number one killer. But we are starting to see a little bit of cardiovascular reduction, okay? And I think the reason why that is, many people say cardiovascular deaths were associated with the onset of refined carbohydrates starting in the United States to become very, very popular, your per capita consumption of sugars. Like in the post-World War II, sugar really shot up, right? You've heard that. Would you say, I'm nodding so I know, yes, you agree with me? All right. You can say no if you don't. Go like this. And then the other thing is people were smoking. You know, World War II was the smokers' marketers' paradise because we gave cigarettes to everyone and all the soldiers. And you're going to say heart disease showed up with smoking. Along with the sugar. Then you're going to say there are those who argue vegetable oil industry, cottonseed oil that was used for machine lubricants became sold because it was cheaper than animal lubricants. All right, so all these things are important. But didn't cars start around 1922 with all the lead in it? And the tons and tons put in all the engines and all the industry worldwide? Pumped in and then showered down on all of the growing fields? Because not everybody smoked, right? And not everybody ate a high carb diet. And not everybody, because my family didn't, my dad was at Armor Food Research, and if my mother bought a bottle of Mazola corn oil, it was an argument. Daddy was really angry at my mom. We are going to have butter and lard and beef tallow in this house, Helen, he would say. And a lot more, okay. And so my parents, in our family, even though my mom's side of the family is full of diabetes, obesity, cardiovascular disease, strokes, heart attacks. My grandfather died of a heart attack ultimately, but not everyone smoked or used those oils or was a high sugar person, and yet heart disease was climbing. And so I'm going to argue that we're starting to see a slight decrease in cardiovascular disease since they stopped putting lead in gasoline, okay, and lead paint on the walls, okay, because that was mandated in the late 80s or around the 80s, and that was when we started to see a little downturn. We also saw a little downturn with cessation of smoking, but again, not everybody smokes, so only about 20% of the population. And cardiovascular disease exceeds the impact that just smoking would have. Do you see what I'm trying to tell you? All right, so what this article is telling you is blood lead levels at what you're being told by the NAINS 3, National Institute of Health does the National Health and Education and Nutrition examination studies, okay? They do this about every 5 years. And in that study, low levels of lead are linked with a huge amount of death. And the reduction of it is associated with protection. Now, the problem is 10 times worse. Let's go to the next article. The next article was, well, let's go to this one first on bones. So you're breathing in your lead, you're eating it in your organic vegetables you're so proud of, and I'm glad you're doing that. And you're getting it in your water, even though you're trying to filter it out. And so lead is coming into you because it's ubiquitous, it's everywhere. And it seems like a problem too big to tackle, but the NIH and other researchers are doing it finally. And I think largely because of studies like this, because remember, we started the TACT trial in 2002, and this study was 2006. Now, a study also by the NIH, published in 2009. This is an article you can see listed here. The prospective study of bone lead concentration and death from all causes, cardiovascular and cancer, at the Department of Veterans Affairs. It's the normative aging study. So they're studying aging. And in here, they do a K-shell fluoroscopy. Has anyone ever heard of a K-shell fluoroscopy? It's only used in research. It's like getting a bone density, okay? But they have a very special methodology when they shoot the beam at your leg or your patella or your tibia. They can actually figure out how much lead is in there. Because where does lead go in you? It goes to your bones. It goes to your bones. About the vast majority, 70, 90% goes to your bones, okay? Now, if it's in your blood, how long is it in your blood? Only days, because having a toxin in your blood is not what you were designed to have. It's cleared out immediately. God doesn't want you to have toxins in your blood. So your bone is slow turnover, right? Slow turnover. You make red blood cells every 120 days, okay? So obviously, we're going to put a toxin that there's no inherent pathway to get rid of. We have no enzymes to get rid of this junk. It gets stuck in our bones, all right? And so in your bones, you're a young person, and on the internet question, you're a young person and you're exercising and you feel great. But what happens when you turn 40? What do we know what happens when most of us turn 40 or older?
Muscle mass.
Your bones start dissolving. Osteopenia, loss of bone mass begins, and especially for women with our loss of our menstrual cycle and hormones, and we're seeing menopause earlier and earlier in onset. And what happens when your bone mineral matrix starts dissolving away? Calcium goes out, but since lead replaces calcium in your cortical bone, you are your own source of lead toxicity by age 40. You are your own source of lead toxicity. All right, now that's what this article is saying about the normative aging studies. An NIH study put out, this one's published by the American Heart Association magazine Circulation, and this was published September 8th, 2009, and it's titled A Prospective Study of Bone Lead Concentration and Death from All Causes. Because didn't we say lead is toxic to everything, your brain, your hormones, your mitochondria, and so forth, right? From all causes, cardiovascular disease and cancer, in the Department of Veterans Affairs normative studies. So you can look this up on your own. I have it listed on your handout there. But again, they're saying, well, let me get you some numbers here. I wrote them down. They are saying, when they looked at the men in this study in the VA, and they were men aged 50 to about 85, because men lose their bone too. Even though women do worse, men do lose their bone. And what they found when they adjusted for being a smoker, their age, whether they were diabetic or not, because we can do that. We have all these patterns. There was an increase of 837% death from all causes in their low lead levels, okay? So they isolated everything out, okay? And they said, what's attributable to lead? And it was the major cause of their death. Back in the article that you have in your hands there, they also isolated out all the cause for death and attributed just to the heavy metals in their studies. And what they found in the 2006 article I gave you, you have it in your hand, there was a 151%, this is the worst, for stroke deaths, environmentally screening all the people. There were 89% more heart attack deaths attributable to lead, and 55% heart disease, and all-cause mortality was 25%. I mentioned that before. So these articles spurred on this last one I want to review, and that is a NAINS 3 study. The same, remember I mentioned NAINS 3 is our government's, CDC does a national health and nutrition education study every few years, and they just look at things like this. Well, they're looking at lead, and this one just came out last year, and it's 10 times worse, folks. The new news is that the information is even worse. This is published, this particular report of the NAINS 3 study from 2018 is in The Lancet, the British very popular medical journal. And what they're telling us in that study is roughly in the United States, there's about 2.3 million people who die every year from all causes, okay? Put everything, accidents, suicide, homicide, cancer death, heart death, every death, 2.3 million. And they clean this out for, let's say accidents and stuff, and they hone it down to screening their lead levels. And what they found is all-cause mortality, when you factor everything else out, 18% of 2.3 million people dying every year is due to lead toxicity, and it's linked to damage in all your organs. So do you think you should start pulling it out, even if you haven't had a heart attack? You betcha. You betcha. And how much is 18% of 2.3 million? 412,000. Do you know how many people die from cardiovascular disease every year in the United States of America? About 800,000 people. So let's look at, we have all-cause mortality, cardiovascular deaths. In cardiovascular, that could be like congestive heart failure, atrial fibrillation. You can die of a heart disease if you haven't had a heart attack. You know, there's other ways to die of your heart besides a heart attack, right? Okay, so let's do cardiovascular deaths. They found that 28% was linked with lead, 28.7% to lead, and that attributed for 256,000 deaths. And then they looked for heart attacks. So now we're talking about the heart attack world, and it was 37.4%, 185,000 deaths. So if you add 412,000, 256,000, 185,000, that approximately approaches how many heart deaths we have every year. And they're linking this with this scratching like your nails on the eraser board. I'm aging myself. I don't think anyone has an eraser board anymore in classrooms, but that screeching sound is that lead, that aluminum, that mercury, that cadmium, that arsenic, that lead, scratching the inside of your blood vessels before it can be deposited and kick out a piece of calcium from your bone. And it's hurting us, and it's hurting all the organs it serves. It's hurting your immune system, putting you at higher risk for infections, chronic viral infections, chronic fatigue, cancers, and so forth. So the elephant in the room is we've got the hard grade A level now. We have the 2006 circulation study, the first report on the NHANES research on low levels of lead. We have the 2009 study, and we have the 2018 study that came out as well. So it's fact now. We don't have to lie or apologize for anything. We're all lead toxic, and we're all going and losing our bone density mass, and lead is leaching out. And if it's leaching out, you better take it out safely and pee it out faster than the damage it can do, okay? And I don't want to hear you complain about saying, I have a mercury filling, what should I do? Get it out, you know, and if you can't get it out, chelate anyway, okay? Because you're dumping it elsewhere too, you know? You can't go and replace your bones like you can replace a filling, right? So you've got to do these things, folks. So I have given you research regarding the TACT trial published in the Journal of the American Medicine and commented and referenced hundreds of thousands of times now. I am giving you journal research publications on the CDC research and the NIH research on low-level lead exposure. I have shown you that everyone's got it, and it is linked with our toxic metals, and is probably foundational to the major causes of death in the United States. So that's why I say lead is the #1 cause of death. That's why I'm saying it. And if you were born between 1940 and 1990, then you have a boatload of lead in you. Okay? Don't look for it in your blood. That's the tip of the iceberg. So the Titanic in the room is lead, and we're all riding on the Titanic called lead. We're riding on her. And you see the little iceberg tip, but the big amount of that iceberg is the lead that's in you right now, because we grew up in a massively lead microfilter that's in our food, our water, and in the air we breathe, and the dust that blows off of, the Mojave Desert there, and the uranium, from Fukushima, that came out of Fukushima. We had just to tell you, I do heavy metal testing all the time. Basically, no one had uranium in their blood in March of 2011. That's when that big tsunami hit, remember, Japan? By June of 2011, every one of you was pouring out uranium. So don't come to me and say, oh, Dr. Ellithorpe, you're a chelation doctor. You're just trying to sell something. I am done with that statement, okay? We have grade A level science. We have the NIH. We have the Centers for Disease Control. We have the NANES 3 studies. And the most recent one in this past year now is confirming that low levels are in us and likely the causative agent behind most of the deaths in the United States every year. It's a silent poison in us. Please get chelation. By the way, and all the people who did these chelations in the TACT trial, all the IV guys put vitamin C in it. I started telling them to do that back in, 15 years ago, okay? And all mine have it in there. So we give you a super duper chelation here. Please chelate. Please think about getting 30, 40 chelations, and then probably do a maintenance of a few every year the rest of your life. Live long. Decide not to have cancer. Have less carbs, okay? Have less strokes and heart attacks, diabetes, and all these things. Now, I brought some of these nutrients out here to tell you why we do this. The Journal of Biology is published on Juice Plus, okay? As far as a cardiovascular lining, vasoactivity, these studies in the Journal of Cardiology showed that Juice Plus, and this is why we use it, stops oxidative damage, reduces DNA damage, and stops the vascular spasms under ischemic conditions. So we use that in conjunction with our chelation. Oh, all right. So we use Juice Plus for the antioxidant here. And so you can get all the fruits and vegetables without all the starch and sugars with them. Our multivitamin is TLC Energy Core. I designed this to put in many liver-friendly, mitochondrial-friendly antioxidants to promote phase 1 and phase 2 liver detoxification. So that's our multivitamin. And I made TLC metabolic formulas since so many people are eating too many carbs and becoming diabetic and sticky sugar. We have designed these things to be actually more valuable and less side effects than things like the diabetic drugs metformin and glipizide and things like that. So this helps lower the sugar because you're going to have more cardiovascular disease with lead in you if your sugars are high. So if this helps lower it, and it does, that's why we give it, okay? We give vitamin K2 with D for an immune enhancement, anti-cancer, because the better your killer cells are, the less likely you're going to get stuck with a cell in your body. And vitamin K2 is also associated with helping to dissolve the calcium that's abnormally placed in your blood vessels, okay, to reduce the likelihood of vascular plaque, okay? So that's why we give it with K2. We also have a D10,000 K2. I usually take one of each. One of the methyl pathways, oh, I know what I forgot, Callan. It was N-acetylcysteine. Okay, N-acetylcysteine is one of the glutathione supporters to help you make glutathione. It takes two N-acetylcysteine molecules. Together, it becomes glutathione. Individually, it's N-acetylcysteine. Glutathione is so big, if you take it and swallow it, it's not going to get absorbed unless under certain conditions, like it with a liposomal wrapping, you can maybe get a good portion absorbed. But anyway, I give it as N-acetylcysteine, and then your body knows what to do, and it makes its own glutathione. But I put that in my multivitamin TLC Energy Core, so that will help you with your phase 2 detoxification of chelating yourself. And the B methylation pathways, remember I told you phase 1, phase 2 pathways? You help yourself methylate so you don't get cancer, so you don't get high homocysteine, so you don't get heart disease. So using a wonderful, rich methylated B12 folic acid is what we use here. We have another one called Cardio B. Again, a very high support of your methylation pathways. And then enzymes are anti-inflammatory, because anytime you've got a damaged area or itchiness, you know, like a pre-pimple in your blood vessels, we use enzymes to kind of help clean away the debris. And this is God's natural aspirin. Enzymes. God wants you to have your enzymes, okay? So I put these out here because I was getting feedback on some of my seminars. Well, what do you do for it? Okay, well, you can tell what I do with chelation, okay? But I want to give credit to Dr. Dorothy Merritt. Dr. Dorothy Merritt is a teacher now of ACAM, okay? And she's a medical doctor, and she's doing videos and teaching seminars, 4M and ACAM, both systems, to help teach more doctors how to do this. And I see patients every day. As a generalist, I have to study hormones, study thyroid, study cardiovascular, study cancer, study arthritis, study digestion, study vision, ophthalmology, study exercise, fasting, weight loss. And she did a wonderful lecture on this, and it's on YouTube, Dr. Dorothy Merritt, M-E-R-R-I-T-T, Dr. Dorothy Merritt. And she is the one that brought me to the attention of the low-level lead exposure and mortality in the United States adults, a population-based cohort study by Dr. Bruce Lamphere, Lamphear, published in Lancet. And so I plagiarized a lot of this note-taking off of her video, okay? But you know what? I'm not going to reinvent the wheel. And this information is too important to not share with my patients. And you have a question?
Yeah, I just have a question about chelation.
Yes.
I heard that there's a sodium chelation and a calcium chelation. What's the difference and what are they both used for?
Yes, there's disodium EDTA chelation and there's calcium disodium EDTA chelation. And there was a lot of argument saying, oh, we don't want to pull your calcium out of your body and give you osteoporosis, okay? So they can actually make a mineral chelate calcium disodium EDTA, and that's what we use here. We use calcium disodium EDTA, and in the 70 years of EDTA chelation, just in the United States, I think worldwide, I don't know of any. I probably could say there were maybe 3 or 4 deaths in 70 years of chelation therapy. And that was really, I think the majority of the 3 or 4 was a child or 2. And the doctor was unfamiliar with chelation, and he gave disodium EDTA, and it hypocalcemic tetany. And since it was a child, they weren't thinking. And you know, who ever heard of a kid not having enough calcium? And the child died. Now, you put 4 or 5 deaths in decades compared to, the 100 and some thousand deaths per year that we kill with the adverse drug reactions, give me a break. That's not even considering the cutting off the wrong leg, the nosocomial infections and stuff. The nosocomial iatrogenic death caused by doctors is maybe the third leading cause of death, okay? Right? So I don't want to hear about safety issues, We've done hundreds of millions of this, and we're talking about 3 people that they keep on, what about those deaths? Well, yes, there were 3, and they were inappropriately trained. I'm so sorry, but hundreds of thousands of millions of people worldwide. We have millions every year now in America. People that know by now. Our organization is powerful, ACAM and A4M. So it's very, 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 very safe treatment. Yes, sir.
Question. I was told that sodium EDTA is better because it'll pull the calcium out of your arteries versus the calcium EDTA.
I've used them both, okay? I've used them both, and I stay with calcium because I don't want to even have the hint, not even a bat of an eye of risk with my patients, okay? Because I chelate every day of my life, every decade of my life. For 40 years, I've been chelating people. And I am not going to have one accident. And I never have. Glory to God. Thank you, Jesus. Yes.
We have about 13 minutes left, and we have quite a few online questions. Do you want to tackle those now, or do you want to?
What do you? Should we take them, or should we take your questions? Let's take.
First one here is it possible to have negative side effects from chelation because perhaps too many good metals are left with bad ones? Are there negative side effects?
Yeah, there are people who say good minerals are pulled out with chelation therapy. I've been around EDTA chelation since I was 7 years old, okay? I majored in chemistry, minored in biochemistry, and I have never seen a healthy mineral depletion problem from chelation after hundreds of thousands in my own personal career. I've never seen that. Never, ever once. Now, I give a multivitamin mineral whenever I'm chelating, okay? I do that, okay? But I've never seen that in my life. Did that answer? Okay.
Next one is, how do I find out how to shop for personal products for the skin that do not contain lead?
I don't have the answer to that. I pay very little attention to beauty things.
Fair enough. The next one is there evidence that chelation helps with pancreatic cancer?
Well, I mentioned in the circulation article, NIH names 3 research on bone lead concentration and death from all causes, cardiovascular disease, and cancer, okay? It is my experience that on many levels, cancer is, there was a Denmark study. I think this was done by their state health, Denmark National Health System in the 1978 to 1994. So there was a period of time they chelated people there. And remember, when open heart surgery started, we wealthy countries, we got to do this, but there were other countries and they had no money to open up cardiovascular surgical suites, right when it was coming out early in those years. Denmark was one of them. And all they had was chelation therapy, and they were using it for their cardiovascular disease. So they had this whole swath of people who had been chelated, and then those not in their country. So they did about a 19-year follow-up on that. And do you know about 93% of the people who had chelation didn't get cancer in those Denmark studies? Okay, it's an isolated study, all right? And I'd have to pull it up and look at their, their stats to be sure. But I have always seen less cancer in chelation people. Now, I've been at this clinic almost 18 years now. Where are all my brand new cancers? It's a handful. I've been here almost 18 years, and I would say maybe 10 people. Linda, you're my nurse. I would say that. I'm not exaggerating, am I? Okay. Where are all the new heart attacks that I've had out of here? I can't think of a new heart attack. Let's be conservative and say there might have been one, okay? What about new diabetes developing in our patient population? You see, because what we do is we're saying get those carbs down, drink that water, move your body, exercise, don't eat late, take your enzymes, use things like Juice Plus instead of excess fruits and juices, and enzymes, and get in here, measure your levels, and chelate. And I'm telling you, I don't have the incidence of the prevalence of new cancers, new cardiovascular diseases, new diabetes, our biggest killers. I just don't have it at Tustin Longevity Center. Thank you, God. To Him be the glory. Because we're doing these things. Now, doctors are not paid to read scientific papers. Now, Talon, you're here, and you're here. Did you see a bigger stack of scientific papers than the ones I've used?
Yes.
Yeah, I have a whole big one at home, okay? And I only picked a few to kind of help me establish, its toxicity, its prevalence in high-grade level A scientific articles. But I'm out here studying for your gut health. I'm studying for your neurological health. I'm studying for cancer patients. I'm studying for my allergy patients. I'm studying for my arthritis patients. And I'm only seeing like 6 to 8 people a day so that I have time to talk, time to teach you, inspire you what to do right? And I think that makes the difference. I think if we do this, it makes the difference because I don't see the disease prevalence here. Does anyone know? I don't know of anyone, And I pretty much, all my patients stay with us. We don't have a large group that leaves. I think very few leave. So anyway, any more questions?
Yeah. Does chelation therapy filter out only heavy metals or any other toxins?
Well, it is a heavy metal chelator. If you think of EDTA as a magnet, and it has negative charges here, negative, okay? And you think of all toxic heavy metals like lead, aluminum, tin, mercury, cadmium, arsenic, they're all positive cations, okay? So if you have an amino acid floating by and the charges, they love each other, and then you pee them out, okay? As far as does it pull out volatile organic acid, PCBs, organophosphates, the answer is no, because those are biochemical toxins, okay? And that's why we take enzymes, and that's why we use high-dose vitamin C to get those out of us, okay? Metal is a metal is a metal. You don't have a system. You don't have an enzyme to pull it out with purpose.
Great. I know you talked about this a bit, but versus the last, how can chelation help type 1 diabetes?
Type 1 diabetes is destined to get vascular damage far earlier than anybody else, much logarithmically faster. And so they're sending you to the ophthalmologist saying, check your eyes, check your eyes. Has it hurt your eyes yet? Not this year. Come back next year. We'll see if it's hurt by then. You come back next year. They check your eye. Oh, your eye is still seeing good. Let's check your next year. Oh, there it is. It finally showed up. There's the disease of the blood sugar on the eye disease prevalence in diabetics, right? Because blindness is very common in diabetics. What's wrong with that picture? Why don't we stop the movement toward the blindness, okay? And if I can improve nitric oxide synthetase and nitric oxide production and get better flow in your tiny little capillaries in your eyes, if I can get it to your brain, to your joints, everywhere, to your heart, you're going to live better, faster, longer, happier. Yes, EDTA chelation is clearly beneficial to diabetics.
Last one here, do I have to be a patient to receive an IV of TLC?
No, what a wonderful question. Thank you for the question. You can actually be a walk-in patient to get chelation here. You can come and we'll do a little brief history and physical. We have wonderful nurses on staff, and we'll do a little quickie exam. And as long as you don't have severe, kidney disease or have congestive heart failure, things like that, we can give you some chelation. Now we start at lower levels, okay? and hopefully you want to see one of us. We have 5 wonderful healthcare providers here. We have the best nurses here. We have the best staff here, very informed. And yes, you can get a vitamin C drip, you can get chelation, you can get glutathione, you can get lipoic acid, you can get a Myers cocktail, relaxation, headache, migraine. It's wonderful to use these wonderful ways to help you.
Actually, a lot more questions, but PA Priya Patel was following along and answering those for us as you spoke. So
Wonderful. So she was answering for us. So our doctors are online. They'll take your call. But how about the audience that came here? Any questions?
Yeah, I didn't quite understand what you were saying about calcium versus the sodium EDTA. Which one is more effective for heart disease patients?
There really isn't. Linda, you're here. You're our chelation RN.
I've done both, and I agree with you. The calcium EDTA by far has it's gentler on the veins, it's gentler on the patient. They don't have the Herx response that I saw with the sodium EDTA. It's, like I said, it's just gentle. There's patients here sitting in this audience that it's like night and day just from getting the EDTA, the enhanced chelation vitamin C's, night and day within just a couple of months.
Yeah.
Coming in,
I have not seen any difference whether they use disodium EDTA or calcium disodium EDTA. I've never seen a difference in the efficacy. Remember, they peed one day and there was, you remember I quoted that wrong? I said 7,000, it was 3,700. But can you imagine how much lead that person peed out the next day?
it's amazing.
So how's that going to remove the calcium? EDTA going to remove the calcium. The calcium's the binder. How's calcium going to pull calcium out of the arteries?
How is what going to pull calcium? Oh, see, your EDTA pulls the calcium out of the arteries. I am not necessarily of that opinion, okay? I believe that EDTA pulls lead, aluminum, tin, and things like that out because it's so prevalent. And there, in chemistry, if you study the physics of chemistry, when you have more of a bully of lead present, natural calcium is never going to be the preferred agent. No, never. Mass action will always take over. And then there's the order of attraction. So lead is the most attractive. Then I think cadmium and so forth as it goes down the line. Now, so calcium is not, I don't think that's the mechanism of action. So don't even go down that road, okay? And then it has its independent action. EDTA is known to enhance endothelial production of nitrous oxide. So all the men need to use this for better performance, so it's true. I feel bad. I'm writing Viagra prescriptions for men and I'm saying, would you please do your chelation? Would you please, come on and help every other part of your body.
One question is, Karen, if you could kind of quickly compare the difference between suppositories as an IV.
Oh my God, there's no way to quickly compare it. EDTA suppositories can only be done by a certain mechanism with a very special carrier for the EDTA molecule. And all the blood vessels in your rectal area, their job is to absorb water out of your poop so that you can poop a solid. Okay, so there's a huge venous blood vessel around your sigmoid and descending colon to pull water out. And so you put EDTA there, which helps dilate the blood vessels, which enhances their absorption. And so the EDTA molecule does get absorbed. I was part of that research. We published this. We did it with the animals. We actually showed a biphasic curve. I actually would say that EDTA chelation is a reasonable treatment protocol via suppository if you can't get in here. But you don't get any of the vitamins, and you could see that the preference was to get chelation with the antioxidant multimineral B vitamins that we put in there. But you're still going to get a great benefit. And there's only one pharmacy that I work with, Harbor Compounding of Costa Mesa, that I worked with in the development of the actual fat that wraps around the phospholipid that makes it work.
That's time.
And we're on time then. We start on time, we end on time. Next September 12th, 2019, Dr. Merrick and Mitchell will be sitting here so you can get a break from me. And they will be going over hormones, hormone questions. So bring your questions, get your friends and family online to look at that. And please, people, get your chelation going. Don't wait for a decade for the government to get insurance. You need it now. You need your chelation now. Thank you.